Good morning and welcome to COVID Talk with local health authorities. With me is Dr. Maria Rivera, representing Harris County, Dr. David Persse, representing the City of Houston, our two local health authorities. This is sponsored by the Rotary Club of Houston. Welcome. I want to thank Kathy Finninger of Rotary Club of Houston for providing us with the questions. I'm Stephen Williams, the Director of the Houston Health Department. A lot have happened over the last few days regarding COVID. And of course, the first question is related to that. J&J hits the news. On Tuesday, Harris County Public Health Statement said they will follow FDA, CDC guidance and pause administration of J&J vaccine at our sites. Residents who scheduled to get J&J vaccine at NRG Park today will be offered Pfizer instead. Mobile sites will be distributing Moderna. What about for the other days? Will my appointment stand? Will you run out of vaccines?
Yeah, so that's a great question, and I'm glad it's being asked. So as of now, yes, we're pausing the Johnson & Johnson vaccination. So at NRG, Pfizer will be the vaccine that's being given. At this time, we do not think we're going to be running out of vaccines. So if you have a scheduled appointment, you should still go to your appointment. That's not a current concern. Of course, we'll keep everyone updated, but we still encourage you to go to your appointment and at least until we are told that we can that it's safe to resume the Johnson & Johnson vaccine.
As a matter of fact, the mainstay vaccines that have been used over the last few months has been Moderna and Pfizer, right?
Yep.
I've already received the J&J and was happy to get a normal reaction. News says within 3 weeks of getting J&J, a severe headache, shortness of breath, leg pain, or abdominal pain indicates contact with a doctor is needed. Would any one of these be enough? I hate to overreact since these side effects sound rather common.
The blood clot of concern with the J&J vaccine that it was reported the 6th is that particular type of blood clot in the brain, and that was the one that set off the FDA to have their reactions. But the point is, and the reason that the FDA is talking about shortness of breath, leg pain, and abdominal pain as well as headache is because the concern is that the vaccine somehow is setting off a cascade where clots can form. So clots often form also in the veins in the abdomen, in the veins in the leg, particularly in the groin area and in the hip, and then also in the lung. They either form in the lung or more commonly they form actually in the legs. They break loose and they go to the lung, causing shortness of breath. So those are other serious clot problems. But the 6 cases they're talking about were all people who had clots in the brain. Therefore, if you should develop shortness of breath, really, if you've got, if you're somebody who doesn't generally have shortness, if your shortness of breath is different, regardless of whether it's from a clot or not, you might want to reach out to your doctor. And same with the leg pain and the abdominal pain. We all know our own bodies. If something is different and it is significantly different, then it may have nothing to do with the virus. I'm sorry, with the vaccine, even if you were recently vaccinated. But if it's significant enough that it's got your attention, then you should reach out to your doctor. So, I mean, I think that the questioner asks the question in a very responsible manner. You don't want to overreact. I don't think anybody needs to overreact. Just pay more attention to your body. And if you're, having one of these symptoms, you don't need to run off to the emergency department necessarily. You don't need to call 911, but you might want to give your doctor a call and see what he or she has to say about what the next appropriate step would be.
Contact your doctor. Treatment of blood clots by heparin is not recommended. Should I stop taking blood thinners before or after all COVID vaccines, or just J&J? Are you recommending that?
No.
No.
So definitely speak to your doctor before you stop any blood thinners. Right now, what we know is that for those that developed the specific type of clot that's been seen with the Johnson & Johnson vaccine, because it's a clot in the brain and it also presents with low platelets and how they think that it forms, heparin just isn't can cause more harm than good. And typically, a lot of clots you treat with heparin and Coumadin. And so it's been a lot on the news because we want healthcare providers to know that with this specific type of reaction, with this specific clot, you shouldn't use heparin. That does not mean that if you've received a COVID-19 vaccine that you should stop your anticoagulants that you are on for any reason. You should definitely talk to your doctor before any of those are paused. But the indication is if you develop the type of clot associated with the, specifically right now, just the Johnson & Johnson vaccine, there's, at least so far, there aren't any concerns for clotting with any of the mRNA vaccines or the Pfizer or the Moderna vaccines. Then in those cases, heparin is not advised, but not just because you've received a vaccine.
The Australian government is recommending people under 50 receive Pfizer. When or if J&J returns, is that a good guideline to follow?
So I'm going to say I think it's way too early for us to know. The only thing, remember that the numbers are incredibly small, but there has been the observation that and when we talk about the Johnson & Johnson, it was 6 women in the United States under the age of 48. The AstraZeneca vaccine used in Europe that had problems with clotting, the same clot actually, is also a it's an adenovirus-based vaccine. And so the concern may be the adenovirus as opposed to anything specific to COVID. And they were also relatively younger people. And so, again, the numbers are infinitesimally small. So there is one theory that younger people are more at risk of this. And so this is where, the Australian government's coming out and saying under 50. I really personally, I think it's way too early to say that there's a strong enough link with youth to make such a decision, only because the numbers are so tiny. I think we need to wait and see as more data comes in. But it's just, it may be just random. We don't know at this point. The numbers are just way too small.
On your COVID data hub, no indicators are met. Please update us. Actually, that was front page today.
Yes. So when we look at the indicators, we look at them over time, and we obviously track all of them. I think one of the patterns that we're starting to see in Harris County is that I know that we've been seeing a little bit more of a decline. Now we're starting to see a little bit more of that plateau, potentially a tiny little bit of an increase in some of the trends, such as hospitalization and the number of new cases, which is why those indicators now have turned red when they were previously green. And some of the others have just stayed in red based on our indicators. And so we don't know if this is something to be alarmed about at this time, but it basically, when you look at the indicators, it just means that for the particular indicators that we're tracking, all 5 indicators that we're tracking at this time, we are not meeting any of them. Is
the news report accurate that less than 1% of Houston residents are catching COVID? I'm wondering where they're getting their 1% from.
It's two thoughts come to mind as I hear this question. So the number of people who are catching COVID on a daily basis, if we look, we don't know, right? Because we only know about those who go and get tested. And right now, the city of Houston is looking at about a 8% positivity rate for people who get tested. But there's a little bit of a bias there because, who goes to get tested, right? You have to ask that question. Well, I've got symptoms, or I was in what I thought was a potentially unsafe situation, or I'm one of the people who goes and gets tested on a regular basis. So who went and got tested? Where I think this comes from is that we did report earlier, the days are all burning together. Several days ago, we reported 142 cases of people who were previously fully vaccinated, which means they were beyond 3 weeks from their last vaccine, that contracted COVID in spite of being vaccinated. And so of the hundreds of thousands of people in Houston and Harris County, and this was a city of Houston data. So of the hundreds of thousands of people in the city of Houston who have been fully vaccinated, 142 is way less than 1%. So I suspect that's where it's coming from.
Yeah, and I agree. The number in Harris County was 96, which was less than 0.1% as well of all the people that have been vaccinated. So definitely less.
Harris County Public Health social media is highlighting the Southern California variant. Have our local cases increased to the level of the UK type?
So as far as I know at this time, the UK variant is still the dominant variant throughout the US and also in Harris County. I think highlighting this other variant is basically we're just wanting to let the population know that unfortunately there are other variants that have entered our community. And so it's something that we are strictly monitoring, and also a reminder for all of us to continue with all the recommendations that we're giving, to continue masking, to continue our physical distance from others, to continue not gathering in large groups, particularly if there's people that haven't been vaccinated in those groups, because as we're seeing in other states, like we're seeing in Michigan, when there's other variants that are taking hold, we're seeing dramatic increases in cases in those states. And so we don't want that to happen in Harris County, and so we're just keeping the population, we're keeping the community up to date on some of the other variants that we're seeing.
My husband insists that when we reach 0 hospitalizations, the pandemic is over. Would you agree?
These are really good questions. When do we decide that the pandemic is over? So there's a couple of answers to that. One will be when the World Health Organization, they're the ones who declared it a pandemic. So when they say the pandemic is over, that would be one way. I look forward to the day when we have 0 hospitalizations. I also look forward to the day when we have 0 infections. But, declaring when a pandemic is over is going to be a little bit tricky. So the only pandemic really that is completely eradicated is smallpox. So on the planet of Earth, we still have polio, we still have measles, we still have a lot of other vaccine preventable illnesses that continue to circulate because of our lack of being able to get. So we've got herd immunity in that. In the United States, measles doesn't spread like crazy like it once upon a time did because we have herd immunity. That doesn't mean it's not here. It comes in tiny little numbers, generally imported, most commonly from Europe. So the question of when the pandemic is over is a good one. And the other thing is, and I think this is important, why I want to answer this question, is that we're coming up now, we're starting to hear that, in some parts of the country, we're worried about vaccine, hesitancy. And I've added the term, vaccine apathy. But when people stop getting vaccinated, that won't be the end of the pandemic. But if we get to a point where nobody else wants to get vaccinated, whatever level of disease that we continue to have spreading through the community at that time, apparently that's what we're going to settle for. And I use the flu. So every year, 30,000 Americans die of the flu. Last year in the United States, 200 children died from the flu. And apparently, as a society, we're okay with that. And it irks me. I think you can tell in the tone of my voice that it irks me. But it'll be the same thing with COVID. At some point, we're going to be okay with how much disease continues to spread in the community, as defined by when nobody else wants to get vaccinated.
One TV doc affiliated with Johns Hopkins predicted herd immunity by April. He defines it by no reported deaths. We're still at red level in Harris County. That doesn't seem like we are anywhere close to herd immunity. Is it possible to declare herd immunity if only one area of a state? If so, what good is that? Okay, we're going to ask our TV docs to respond to that.
It's still a little bit controversial how herd immunity is being defined, and whether herd immunity is defined as no deaths, whether herd immunity is actually defined with the number of people in the population that have been vaccinated. If we're using that definition of the percent of the population vaccinated, and even the no deaths, I agree with the statement that we're not near herd immunity in Harris County yet. And this is such a there's so much travel in between counties, there's so much travel in between states that if there's only one community or there's only one state that has reached quote unquote herd immunity, it won't be as helpful as if the entire state, multiple states surrounding the entire country all reach herd immunity.
I am from Brazil, and I wonder why the U.S. is accepting travelers from there with such high virus numbers when other countries are banning entry.
I would say that's an excellent question, but it's a federal level question.
You're local TV docs, right? Now,
Right.
Does your wastewater project confirm that we are counting the correct numbers of positive cases, or why are we undercounting because of low testing? There is some consistency in what we're seeing, isn't it?
Well, we're seeing consistency in that as the wastewater levels level off, the amount of virus in the wastewater seems to be leveling off. We are seeing that the positivity rates are leveling off and the admission rates to hospitals are leveling off. And we're seeing it, whatever's happening in the wastewater usually precedes the positivity rate, and that precedes the hospitalization numbers by, up to a couple of weeks. So we're seeing consistency. But the one thing you have to be careful about when you look at the wastewater is that you cannot use that to then extrapolate to say, how many people are infected. And it has to do with, number one, the wastewater is all mixed up, right? From all these different toilets, it's mixed up. And the other thing is that their individuals contribute differently to that wastewater. And sometimes it's based on their health. And COVID can cause diarrhea, for example, but so can other illnesses. And so you really can't extrapolate the amount of virus we're seeing in the wastewater to the number of people that might be infected. It's just, there's too many, it's just too far apart. You can't do it that way.
In Houston, 142 people have tested positive for COVID-19 despite being fully vaccinated, and 96 from Harris County. Your reaction?
Yeah, so I think this highlights a couple of things. One, that the positive is, as we mentioned earlier, this is a very small number. We know that vaccines, unfortunately, are not 100% effective, but the fact that only that many people have gotten COVID-19 after being fully vaccinated is actually something that we should celebrate, the success of this vaccine. It's less than 0.1% of the population. And I think in general, it's just something that we know that vaccines aren't 100% effective, which is why we're still recommending masking even after you've been vaccinated, and especially now that we're seeing more variants throughout the community, because until we reach that herd immunity, until we reach the majority of the population being vaccinated, we are still going to see these breakthrough cases. And so this is something that's expected, but I think that the levels at which we're seeing them is actually really reassuring, and shows how effective the vaccines actually are.
We're continuing to look for more cases. We're following up with folks to see whether or not they require hospitalization. To my knowledge now, of the 142 in the city of Houston, none of them required hospitalization. So that's all good news.
Do blood clots and low platelets show your immune system is responding?
So I would say no, it's unrelated. So the blood clots, we don't understand exactly how the blood clots are being formed in response to the adenovirus-based vaccines. So until we have that link figured out, you can't necessarily connect it with the immune system. So your clotting mechanisms in the immune system are separate, independently operating functions within your body generally, but not absolutely. So I don't think you can say that it shows that your immune system is responding, because if it was, you almost, like I said, it's too complicated. We can't say that yet, no.
AstraZeneca and J&J are both based on a modified adenovirus vector, and both have unproven connections with blood clots. You're referring to that. Is there any other similarity between those two that doesn't seem to impact Pfizer and Moderna?
So I think scientists right now think that the mechanism has to do with the fact that it's an adenovirus viral vector type vaccine. And so because the Pfizer and the Moderna vaccines are not using that technology, they're mRNA-based vaccines, that's one of the reasons why they're not showing any form of connection to blood clots. So yes, just the way that the vaccines are produced and the technology behind each vaccine is at least right now the theory as to why the two adenoviral vector vaccines are possibly related to blood clots.
Can I add one thing? So earlier, Dr. Rivera did a really good job of talking about heparin and the complication. The other thing is that heparin itself has this very rare complication where, although it is a clot, it's generally used to prevent and help dissolve clots. It also has this very rare complication where it can sometimes cause clots itself. And so one of the questions is, does the adenovirus somehow increase your risk of having this complication? Instead of it being the adenovirus setting off the clots, it can be the adenovirus then starts problems, and then when you add heparin to it, it then sets off this rare complication of heparin. And the only reason I talk about this is just to illustrate to people just how incredibly complex this current question is in trying to figure out what's causing the clots.
Please warn viewers not to show vaccine cards on social media because it contains information that could be used for fraudulent reasons. Just by reading that, I think I've warned them, right? I actually found my card a couple of days ago. I was so happy. A study by Moderna reports that antibodies persisted 6 months after dose 2, just like Pfizer, though declined more for participants aged 56 and over. What does this say about the immune system? Will we need to wait an entire year to see if a booster is needed?
Yeah, so I think right now the data is coming out as it happens, right? So it's kind of happening in real time. So from those individuals that were in the study, now we know that it's at least 6 months. In general, it's not uncommon for those that are older to have declining antibody levels with other vaccines, and so that's not entirely uncommon and not too surprising. But I think in general, we will need to just continue to follow the data and just wait and see, since it is happening in real time. The studies happened a couple of months in advance of the general population getting vaccinated, of course, and so we'll have a couple of months of lead time. But I would anticipate that we would need at least 6 months more to know if we need a booster or not. I think that's a reasonable timeline. Dr. Persse, I don't know if you agree.
Oh, I absolutely agree. In fact, I fully anticipate that 3 months from now, they're going to come out and say that they know it's good for 9 months. And then 3 months after that, they'll say they know it's good for 12 months. And then hopefully 3 months after that, they're going to come out and say it's good for 15 months. And that will then continue. The other point in the question is that it declined a little bit more in people over age 56. I want to jump on that a little bit because while the value has declined, it is still well above what they think is a protective level. And so to reinforce the reason why you need to get both doses, because there's also some talk in the media about, how effective one dose is, and raising the question, people are saying, well, then why do I get the second dose? Well, you get the second dose to really drive your levels up and also give you that longer protection. So, and then the fact that people 56 and over, well, that's not a surprise either. As we get older, our sight gets a little bit less, our hearing gets a little bit less, everything becomes a little bit less effective. So again, particularly if you're over 56, or, everybody should get the second dose, but it's because it really gives you that solid immunity and most likely for a much longer period of time. So go get your second dose.
Well, David, I was starting to take your comments personally when you start talking about all of that stuff not working anymore.
Well, my hair follicles stopped working, and I'm just really upset about that.
It was long before 56 for me. COVID arm. On the inocular arm can be a delayed reaction after a shot. Rashes are appearing on different areas of the body. Would this slow an allergic reaction? If so, won't the second shot be worse?
So let me see if I understand this question. I think there's different types of rashes and skin reactions that you can see after the vaccine. For the majority of allergic reactions, you're going to see them within 30 minutes after the vaccine is administered. So you may develop hives kind of all over your body. For the COVID arm that they're referring to, your arm will definitely be sore right away. Most people are reporting soreness, and then some people will develop what looks like a red circle on their arm. It can become a little bit warmer. It can become a little bit, can feel a little bit firmer to touch, and that can happen a couple of days after the vaccine. I don't know that I've heard about other rashes that are appearing several days or weeks after as being related to the COVID-19 vaccine. I think that it could happen, but I don't know that I would necessarily think that that's an allergic reaction. But I think if an individual develop some form of rash and they've had the COVID-19 vaccine in the last couple of weeks, I think it's reasonable to call your healthcare provider to get it looked into to see if it could be related, but also to make sure that there's nothing else that's being missed.
So my wife had this happen, but she also had it happen with her flu shot and with both shingle shots, and she had it happen with both COVID shots. And so it's, it can happen, and of course she was getting the flu shot and the shingle shots long before the COVID shot was even available, and she got it. And the first time she got it, I thought for sure she had a skin infection from the injection. And she said it didn't hurt as bad as she would have thought it would, and so we kind of debated, and then it just went away. So if it was the bacterial infection that I was afraid it was, it would not have gone away like it did. So it was this skin reaction to her shot. But like I said, that was, I can't remember if that was the flu shot or one of the shingle shots, whatever the first one was, but she's now got it. She's had it 5 times in the last year. So anyway, it's just an N of 1.
It's been reported that COVID tolls occur in the winter, not summer. True or false?
We're seeing rashes occur in a variety of places on people following the vaccine, and toes is a common one. But there are also viral illnesses that will set off the same phenomenon. It's actually called, what's the name for it? Chilblains is sort of the common term for it. And we see this, and dermatologists see this not infrequently. Now, viral illnesses tend to be in the winter, and so they tend to see more of it. But now they're seeing it following people being infected with COVID. And so it may be that COVID, it's one of two things. COVID may be more likely to cause this complication. And by the way, most importantly, it appears to be completely just a nuisance. There have been no serious complications from it. As far as I know, everybody has recovered just fine. But it may just be a complication of the virus itself. And in some cases, I've heard that is the only symptom people had, was that they had the COVID toes. And you're also going to hear about COVID fingers too. Same thing. It's the same skin thing.
I've heard a caution about using antibiotics prescribed to treat a vaccine reaction since it is not a skin infection. Why are antibiotics contraindicated?
This goes back to Dr. Persse's anecdote about his wife. It essentially, if you're having a reaction right after the COVID-19 vaccine, and sometimes it can be really hard to figure out, is this a bacterial infection or is it just a local reaction to the vaccine? Because often it looks very similar. The site can look red, it can feel hard, it can feel warm to touch, and it can be tender. And I think that we would recommend seeing your physician to have it really evaluated. If there's no fever, often what we've seen with the COVID-19 vaccine local reaction is that it isn't as tender, and I think Dr. Persse mentioned this earlier too, that it isn't as tender as you potentially would expect with a skin reaction. And in general, if you don't think that it's an infection, we just avoid antibiotics for things that we don't think are a bacterial infection. They can cause side effects. They can cause help increase antibiotic resistance to certain bugs, and so it's a little bit hard to tease out. But if there's no other signs of infection, you've just had the vaccine, then usually you just kind of watch and wait.
Okay, a new term, coronasomia, during a pandemic is a new word for me, but it might explain why counting sheep stopped working. Insomnia impacts physical and emotional health. Is it caused by broken routine, stress, sitting all day in meetings, all of the above, or something else? It's based on sort of two things. One is that our routines have been interrupted for many people, and we do have a routine. We generally get up at the same time. We need to go to, and the older you get, the more it applies. You need to get up at the same time. You need to go to bed at the same time. But during the day, you need to also have stimulus, right? You need to be engaging. And so for a lot of folks who wake up and get on the computer and sit there all day, and then at the end of the day turn on the TV and then go to bed, your brain really hasn't been stimulated enough just by getting up, walking around, meeting other people, doing things. And so it's completely disrupted your sleep wake. Even if you go to bed and wake up at the same times, if you don't have that interaction during the day, it can impact your sleep. So hopefully as things start to, hopefully we will be at a point soon, enough people will get vaccinated that we'll get back to normal life, and then hopefully we'll see this go away. Connection between mast cell activation syndrome and COVID.
Cell activation syndrome. Now, this is a challenging question because this makes me reach way back to med school because I'm not an immunologist. But mast cells are these part of your immune system. They have these granules in them that have stuff in them that work in your immune system. Now, a lot of people have severe allergic reactions. There's a over response by mast cells setting off allergic reactions, and so. COVID can do it too. Any infection can do it. A viral infection, a bacterial infection, any infection can do it. But mast cells are also part of when people have the severe allergic reaction known as anaphylaxis. And so even with the vaccines, we worry about it. So, yeah, there is a connection, but it's, I don't know that it's any worse with COVID infection or the vaccines, but it is a phenomenon that happens with people's immune system where it overreacts. And the worst complication is the anaphylactic reaction or anaphylactic shock.
Does regular steroid use impact the effectiveness of the vaccines?
Yeah, so this is something that scientists are still looking into. I think the preliminary research is showing that even some people that are on immunosuppressive medications can still form antibodies after receiving the COVID-19 vaccine. I think that it's something that's is definitely still a concern, and so scientists are still looking into it. There's a lot of research being done in this area, and generally the recommendations to talk to your rheumatologist if you're on steroids or whoever your provider is before stopping any form of medication if you're going to get the vaccine. But generally there's at least some protection that's being seen.
This is a comment. I'm rather angry at news reports that say only 18 people died after getting the shot. The number who vaccinated is large. So even when statistically percentage is low, the comment is cold and the number to me is high. I think we pretty much believe the same thing. I mean, we take that seriously. We think any death is, something that we would want to avoid.
Yeah, I'll add, so absolutely. So this goes back to the flu. So every year we lose 30,000 Americans to the flu. For some reason, as a society, apparently we're okay with that. 200 children last year alone. I'm not okay with that. So anyways.
Okay, this is from last week. I'm going to do it anyhow, since we're on a different medium. ARP had an interesting report. What do you think? Women have a stronger immune response to vaccines than men.
I think we laughed about this a little bit last week. I think it's some of the trends are showing that women are tending to have more symptoms after the COVID-19 vaccine than men. Whether it's a true trend or not, I think it remains to be seen.
But it's not necessarily due to a stronger immune system.
I don't think so.
More women than men are experiencing side effects for the vaccine. You just said that it seems like that might be the case. Men are less likely
They're reporting it.
Okay. Men are less likely than women to report side effects. Will the docs agree on this one? Who knows?
Yeah, we can only go with the reports, and I think women are reporting more side effects than men, but we don't know if it's a reporting thing. So I think it remains to be seen.
I'll help you out. It could be that women are being more responsible in their reporting than men. That neutralizes it a little bit. I want to thank y'all for joining us with COVID-19 Talk with Local Health Authorities. With me was Dr. Maria Rivera, representing Harris County, Dr. David Persse, representing the City of Houston. Thank you, past President Kathy Finninger of the Rotary Club of Houston. I am Stephen Williams, Director of the Houston Health Department. See you next week.